We know that 72% of women have noticed skin changes after using hand sanitizer. Could this be a long-term problem?
I'd like to think we were all washing our hands regularly before coronavirus came along. However, there is absolutely no question that all of us are much more conscious of it now. And importantly, we're washing our hands not just more often, but for longer. Now, a lot of people don't realise that even water can dry your skin out. We don't recommend, on the whole, that people use soap substitutes, which are normally given to children with eczema, for instance, as an alternative to soap if you're washing your hands with soap and water. And of course, in addition, we're encouraging everybody to use hand sanitation if they can't wash their hands. Add that all together, I'm not remotely surprised that 72% of women said they were having more problems with dry hands. In fact, part of me is only surprised that that figure isn't higher. So we can do a lot. The one thing we must make sure, though, is that people continue to sanitise regularly. Until now, we've recommended 60% plus alcohol gels because we know that they always work if you use them properly. Of course, we recommend hand washing when you can. But the problem we've got is that if you're not going to use it because it's drying your skin out, that could be a risk too. So it's great to have alternatives such as hypochlorous sanitisers because that may encourage people to wash more or to sanitise more.
What hand hygiene advice would you give to patients?
If you've had skin issues linked to hand sanitizer use, you need to moisturise more, almost certainly. Moisturisers don't last very long. They're very effective, and what they do is replace water that's lost and to an extent provide a barrier so that you don't lose more water. But very often that isn't enough. I do not recommend that you stop washing your hands and you stop sanitising your hands because we know that while the spread of COVID may not be as much as we originally thought through so-called fomites, which is contaminated surfaces and touching them, we do still very much think that there is a role for picking up the virus on your hands and spreading it through your eyes, your nose or your mouth. Therefore, if you find that alcohol-based sanitisers are irritating your skin and it's putting you off from washing, I would suggest that you look for an effective alternative, and using hypochlorous acid is an effective alternative which is gentler on the skin. It's widely used in hospitals, has been for many years for disinfection, and indeed has been well proven to be very gentle for the skin.